Welcome, everybody. It's the fourth night. I'm glad to see so many people still getting on the Zoom. It's a lot of Thursday nights in a row, and I appreciate your sticking with us. I wanted to mention that next week we'll have Richard Earhart as our guest speaker. I'm going to give a short talk on ID and record keeping, and then he's going to talk about his farm. He used to be in New York State. He had 400 sheep and does out-of-season lambing or multiple times a year lambing, and he's now the sheep specialist in Michigan, and he's done a lot of interesting things out there. He's a great speaker. He practices what he preaches. He has a family farm. I enjoy talking to him anytime, and I'm sure he'll do a great job. So hopefully you'll join us next week to hear Richard's talk. He did do the couple of the talks that I put in, I can't remember which, probably the first week when he talked about accelerated lambing. I think there's another one by him. So let's get started. We're going to talk tonight about sheep and goat health basics. And it's really, we're going to talk about sheep tonight, but there's a few goat things in there. So probably the most important thing, and sometimes one of the hardest things, is to find yourself a vet that's a veterinarian that knows something about sheep, or even if they don't, they're interested in learning about sheep. I know when I first had sheep, we live in a very heavily dairy farm populated state, and they didn't really even want to talk to me on the phone, much less come and see my sheep. But we now have, there's actually three. The woman that teaches the SUNY Canton Vet Tech program used to have sheep of her own. One of our other dairy vets grew up raising lambs for the fair. And we have another new young woman vet that she doesn't have any of her own at the moment, but she is specializing in small ruminants, both sheep and goats. And so it's great because that's what she likes to do. And she's looked into, studied that especially, and she's a great asset to our county. So how are you going to find a vet, especially if you don't have any other livestock? So you might have to ask another producer who they like. If you already have cows, for example, you might ask that vet if they are willing to do sheep, or if they like to do sheep, or maybe somebody in their practice likes to do sheep. And maybe there's somebody you want to avoid. We have one really good vet who's great, except that she never returns your calls. And I wouldn't necessarily avoid her, but I would keep that in mind. So it's important that you have somebody that will respond when you need help. And costs can be a factor as well. Our horse vet is a really nice person and would help me out in a pinch, but she would charge me a lot more than the sheep vet, interestingly. So just lots of things to consider, but maybe ask some other producers who are in your area. And then the other thing you can do is, used to be you could look in the yellow pages, right, and look up the veterinarians and give them a call. Now you have to Google veterinarians near me or something like that. And call some of them and ask if they're taking new patients. Do they have anyone on their staff who knows sheep or who's interested in sheep? And they're usually pretty honest about that. Some of these bigger vet groups have a fairly high turnover, which is kind of frustrating. But if you can get a couple good people lined up, that'll help you in the long run. And once you find somebody, you're going to want to plan a well farm visit, which seems like a waste of money, but it really isn't. So what you're going to do is call and tell the vet that you'd like to make an appointment for some time when he or she's not busy, when they don't have to come for an emergency, and they can come and see your farm and meet you and see your animals and your management style. And you can maybe discuss with them some challenges you're having and that sort of thing. And that way, when you call them later and you need something, you need BOCI or you need medicine or your vaccine, or you need advice, lots of times they'll answer you on the phone. Or you might be able to bring a lamb into their office and they know a little bit about your farm, because so many of the sheep diseases are affected by your management. So plan a well farm visit. It's worth paying for. I think it'll save you money in the long run. And I see that these slides are really bright green when you have them up on slideshow presentation. We're going to talk about some of the basics. We're going to talk about vital signs, basic care of the animals. How do you know when your sheep is sick? So should you call the vet? Little bit about hoof care, and we'll talk about where to give injections and some possible vaccinations. So vital signs, and I say practice on a healthy sheep. Well, sheep don't really like to be handled that much, but if you have them caught up for something else, you might take a look at their respirations and listen to their heart if you have a stethoscope. If you're working with a sick animal, you should be a little bit careful, wear gloves, safety glasses, potentially, if you can. Or I wear glasses anyway, so I'm covered there. And you should try to keep the animals calm, both if you're just checking them to practice and also if they're sick, because if you get them riled up, they'll sometimes collapse if they're sick. The thermometer is an important thing to have. I really like the old mercury thermometers. They're not very easy to find or get anymore. There's a lot of digital thermometers out there, and I use one. I don't have many sick sheep, so it comes around about every time I want to use one, it says low battery. So I like to have a regular thermometer that doesn't need a battery also. So you want to spit on the end or put a little lube on there, put it in the rectum, make sure you get it in the right spot, and keep it in there. I tie a little string to mine if I can, something so if it falls in the straw, I can find it, little ribbon or something. That curly ribbon works pretty good. And you want to wait a few minutes and then take a look at it. And the normal temperature is 102.5, but you'll find that sheep vary quite a bit with the outdoor temperature. And you'll see it on a hot day, it'll be 103 or a little over 103. If you're up to 104, 104.5, they definitely have a fever. And if they're dropped much below normal, they're probably going into shock and maybe on their way out. So the temperature can tell you a lot. And that is one of the first things the vet will ask you when you call, do they have a fever? And if you are fairly experienced, you may be able to tell a lot more even without a thermometer whether they have a fever because they're panting or they look uncomfortable. But it's nice to be able to tell the vet that you took the temperature. Their normal breathing is 12 to 24 breaths per minute, which is pretty slow. And I was watching our sheep. We brought down 3 sheep today at the extension farm. Well, we actually brought them down last week into the barn because the ram got out in September and we're expecting a few unexpected lambs. And we wanted to bring them in because it was below zero last week. And today, of course, it was 33 and the sun was streaming in the windows and they were actually panting because they were warm. And their respirations were much higher than that, but I believe they were just warm. You can also look to see if they're straining to breathe, like really, you can tell sometimes they have to really work at it, or gurgling, like their head's down, they're gurgling a little, or panting. You can actually see it on their sides. You can count the respirations. The heart rate, by the time you handle a sheep to listen to it, its heart rate is going to be up a little bit, but its normal heart rate is 70 to 80 beats per minute. We have a super friendly bottle lamb that is great for practicing on because she likes the attention and then doesn't get wound up when you start poking her and putting the stethoscope on her and that sort of thing. So think about, what to say. It's nice to be able to hear the heart and know where to listen for it. So you would put the stethoscope behind the left front leg, and where there's not a lot of wool there, you can put it on their chest right behind the front leg, and that's usually a pretty good spot to hear the heart. You can the rumen, which is their big stomach that we talked about during the feeding unit, should be working, and they should ruminate at certain times a day. That's a really good sign of health, and you can listen with a stethoscope, or you can even feel with your hand, but mostly you can just watch them, and they're eructating, and then they're chewing, right? They're just chewing. And then their rumen would be on the left side between the hips and the ribs. And so if you look out into a group of sheep and they're all laying down and they're all chewing their cud, and then there's one in the corner by herself and she's just holding still. Her mouth is still and her ears are droopy and she's not ruminating. So something's off. So the rumen is important to look at also. And then we want to look at their general appearance. I tried to find pictures for all these things, but all you see is a bunch of droopy sheep, and it was kind of depressing. So I didn't put a lot of pictures on these pages. But their general appearance, are they eating and drinking and pooping? You can tell if you feed them every day or if you go in and fluff up the hay in the feeder, and you can tell if they're interested in eating. It's hard to tell if they're drinking if you have automatic waters. And usually if you walk around, you can get an idea. If you have a sick one and you put them in their own pen and you give them a bucket, you can tell if they're eating, drinking, and pooping. Are their eyes perky and clear, or are they mucousy, or are they their head hanging down? Sometimes they're limping because they don't feel good, or their balance is off. Just picture Eeyore from Winnie the Pooh, for those of you that know Winnie the Pooh, kind of droopy. And you might also look for neurological signs. Some of those would include head pressing, like if they're standing with their forehead against the wall, like they're pushing. And if you could see me, you'd see that I was demonstrating that. I should have the video on. There's sort of a circling, like they're trying to go straight, but they keep walking and going to one side or the other and circling. Sometimes they're throwing their head back, like in polio, and we'll talk about that in a little while, like back over their back. And I had one that had listeriosis, and she'd scratch with her foot, and I couldn't make her stop. And it wasn't because her head itched, it was because it was like a nervous thing. So if they see something unusual like that, there's a good chance it's a neurological thing. Or you might find that they're acting like they're blind, because they might be blind. So how do you know if your sheep is sick? We just talked about a few things, and you should call the vet. So if they have a respiratory problem, you have raspy breathing, snotty nose, coughing. I have one that coughs because she eats her grain so fast that she chokes. But if they cough when they're running back and forth to the round bales, or when they're playing or getting up and down, they shouldn't be coughing steadily, and they shouldn't have snotty nose. And you shouldn't be able to hear them breathing. Diarrhea is, if there's diarrhea in an adult animal, there's a good chance it's parasites. And it could also be yonis. There's a couple things, coccidiosis, but in general, you don't see a lot of diarrhea in adults. So that would be a sign that maybe something was off. Now, I will say when they first go on the green pasture in the spring, they have very soft manure. It tends to be very green. And it isn't watery, though, or really runny. It's just messy. It's softer than normal. And it shouldn't be off color. So if you see dark manure or diarrhea, or that might have like dried blood in it, or it's clear or watery, there's definitely a problem. And lambs, same with lambs, they have sort of yellow manure at first when they're just drinking milk, but they shouldn't be really runny. Occasionally they have a lot of manure because they stuff their little faces, but if they're acting okay, I would watch them. If they're not acting okay and there's diarrhea, then you need to do something, the best thing would be to call your vet to start with. Are they off feed? If everybody else is eating and one sheep is not, if you put grain out and they don't all run to the feeder, that's a really good sign that something's not right. With sheep in general, if somebody's not doing what the rest of them are doing, that's not a good sign. Unless it's the bottle lamb, because they don't always act like sheep. If they're listless or droopy, or again, if there's behavior changes like standing off by themselves, standing with their head in the corner, pressed against the wall, something weird like that. Or they might look sucked in or dehydrated. If you look at their eyes and they look like there's space around them, they are dehydrated. It's a little harder on sheep to do the skin test, where you pull up a tent of skin and let go to see if they're dehydrated. It should go right back into place because of their wool. But if there's some spot on the sheep, you can do that. You could check them that way. So another thing that you sometimes see is teeth grinding, or salivating, or foaming at the mouth. And the grinding teeth is a sign of pain. And the salivating and foaming at the mouth is a sign that they're having trouble swallowing, which is likely to be some sort of neurological problem. So basically, they aren't able to swallow their saliva, so it comes out of their mouth. Are they bloated? So bloat would be when air collects in the rumen. Like a couple of things can happen, but the one that usually happens is they get foam in the rumen and they aren't able to burp up that foam. And so their rumen gets bigger and bigger and bigger on the left side. And that isn't so bad, except after a while it starts to press on their lungs. And after a while they aren't able to breathe. So you do need to do something about it. And they do sell bloat medicine, which is basically something that breaks up the little foam. Sometimes a little vegetable oil will work. And bloat can be frustrating because it's not always obvious why they have it. It just got off a little bit and bloated. And it sometimes also happens to lambs on milk replacer. But you need to somehow relieve that pressure. And if you really get desperate, then you can actually poke a hole in their side. But I would recommend having the vet do that for you rather than you doing it. Usually you can resolve it. I've actually used Mylanta, which has simethicone. It's not really labeled for lambs or people, so be careful, but it does work. You can buy simethicone for little baby people. It comes with an eyedropper. You get some of that into them, or you can actually use Mylanta and give them a little drench, or Mylanta or something with simethicone in it like that. That it breaks up the gas bubbles and will help them. How about their body position? Are they standing like a normal sheep, or are they humped up? Like, is their back humped up, which is a sign that their stomach doesn't feel good, or their abdominal area doesn't feel good? And are they dragging a leg, or is there an injury? Sometimes you can see where they got bitten on the neck, or they caught their foot in something. I used to have where the sheep at the extension farm slide down the hill. They sometimes slide down the rocks, which is great for trimming their feet, but sometimes they'll catch an ankle and they'll like sprain their ankle or something. Usually not too serious. And I put squinty-eyed there because when I had liver flukes, I used to tell the vet the sheep were squinty-eyed, and I think that's because they were in pain. And I don't know how to describe squinty-eyed other than they're squinty-eyed and they're sort of looking internally like they're just trying to be stoic through the pain. So I'm not trying to scare you with this presentation because sheep in general are pretty healthy if you do all the basic things right, but there are things that can go wrong. So now you called the vet and you got to be ready to answer questions for the vet. So hopefully you check their vital signs, or at least you observe them. And you may be able to treat the animal yourself if the vet can give you advice over the phone. But you want to be sure you ask enough questions. So if they tell you what to use, make sure you ask how to apply it. Like, is it injected? Is it oral? Is it a pour-on? And then if it's injected, is it intramuscular or subcutaneous? Or is it need to go into the, intravenous? And then sometimes vets assume you know all these things, but you need to ask, where do you get the medicine? Like maybe you have to get it from them. Or even if they're there and they give you the medicine, you want to know how long before you should see some improvement. Like, should you wait 3 days and then call the vet again if it's not working? Or do you just keep giving it until you see some improvement? And with some medicine, it's very important to give it on a schedule because it either stays in the bloodstream not very long or a long time, like long-acting oxytetracycline. You can give that every other day. And there are ways you can give a dose that'll last longer than that. So be sure to ask a lot of questions and preferably jot them down in a little notebook or in your phone, as my kids would say. Just put it in your phone, Mom. So you can use, when you use the vet, don't be afraid to ask questions. I think they would prefer to give you all the information. It's just when they're in a hurry, sometimes they do forget or they assume you know, and sometimes you don't. So there's some other people that can help you out. If you can find a mentor, somebody else that has sheep in your area that does a good job and is willing to take a few phone calls or stop down and help you, show you how to give injections the first time, for example, that's great. And some places have a program to help you find mentors. You might be able to work with your extension office to find, a 4-H leader or somebody that could help, or another producer that'd be willing. And I mentioned earlier, have the vet visit when everyone is healthy. And a lot of times the vet will show you, they don't really want to come and vaccinate your sheep, but they might be willing to come and show you how to vaccinate your sheep and then let you do it. Be a little careful. There is a lot of great stuff online, a lot of great YouTube videos. Just be a little careful of the source. You know, something from a land-grant university is probably safe, or that you go to, like from the Maryland Sheep and Goat page that directs you to something. There are some very well done producer videos as well on YouTube. Just if it seems a little off, you know, ask somebody before you take that advice. It is sometimes hard to filter those things when you don't know enough about what you're looking up. So we all would rather do preventive care than treating our animals. So I mentioned during our feeding thing, you need to keep them not too fat, not too thin, feed them correctly, and then you know, as much forage as possible. And don't forget the minerals. And I have a hard time remembering the minerals, like when we switch over to second cut or we go out to pasture, and I still need to give them minerals. So I need to remember to keep that up, especially when they're getting close to lambing. So you got body condition, not too fat, not too thin, lots of air. You know, if you're cold, the sheep are probably fine. If you're warm, the sheep are really way too hot. So make sure there's just fresh air. Closing up the barn is one of the worst things you can do. We used to have all our sheep in the main barn, which was an old dairy barn. As long as we left both doors open on each end so that the air blew through, they were pretty good in there. If you shut those doors, or if somebody came along and shut them on us, we'd have a whole barn full of 6 sheep the next day. So ventilation is really important. Better for them to have a little fresh air than, and for it to be cold than for you to be comfortable. And I should mention, you forget that the air up where you're standing up is different from the air where the sheep are. So if you dare go around on your hands and knees, or at least squat down and see what the air is like closer to the bedded pack or to where the sheep are laying, it's a good idea. We actually, in one barn at Cooperative Extension, be a great picture to put in here, we actually cut vents low down on the barn that we can take out in the summer, and so take like a sliding door out, and they have hardware cloth over them, but they're down at sheep level, so they let the air through. And it helped a lot because it's a barn without an opening in the ridge. So the other thing is to, the reason I said if you dare kneel down around the sheep, because if I do that, my big white guard dogs come and tackle you and think you want to play, which is really fun if you know they're coming. We want to keep their hooves trimmed, and I actually, I don't have to trim a lot of feet at either of my farms. You know, I spot trim. I also know people that trim all their animals twice a year or once a year. It all just depends on the situation and what they're eating and what they're walking on. And so I did a little, just in case some of you haven't seen hoof trimming, I did like a little 5-minute video today with some pictures I had of me trimming a goat. So the animal is not in the position you would use to do a sheep, but you can see the hoof, you can see how the edges grow over, you can see how I use the trimmers to trim. It's just I just stuck it in at the bottom of this week's lesson this afternoon at about 2 o'clock. So it's important to keep your feeders cleaned out, especially if you're feeding silage, because you can get listeria in there. And your water is cleaned out. And if you don't have easy to clean waters, that makes it really hard. It's nice if we can dump your water, or in the case of our heated Nelson waters, we can scoop them out pretty easily with our hand. So make sure you have something that you can clean out, and do it once in a while. Quite regularly, actually, would be good. And vaccinate your animals if it's recommended. And that's where your vet comes in to recommend, and maybe some of your local producers could tell you what they're doing. And we'll talk about vaccinating in a minute. And we talked about parasites last time, so you need to constantly monitor parasites during that time of year when you're on pasture. And then you need to treat them when needed, just the ones that need it, of course. Try not to buy in problems, and take precautions. Like when you bring them in, it's a good idea to quarantine them. I can tell you then, even when you quarantine, you don't always catch everything, but you're likely to catch the big things, or some of the big things. Foot rot is one of the easiest things to bring in, and you don't always see it. They aren't necessarily limping when you have them in quarantine. This is how I got foot rot in my own flock, or foot scald mostly I have. And then I have their plastic boots, etc. That means when somebody comes to visit your farm from another farm, you either make them wash their boots with disinfectant and water and a brush, or you make them wear plastic boots that you can buy online to keep them from tracking any manure onto your farm that came from their farm. And there, you had to have a little picture. I love this picture of the sheep up on the ridge. Okay, vaccinating and injecting. So you're going to follow the local recommendations because there are some differences in where you live and what's the problem and what's in the soil. But everybody uses CDT, which is 2 types of overeating disease and tetanus. So that's a 3-way. Clostridial is what they call that. And it's an easy shot. It's 2 mLs for all the different size animals. You have to give it once, and then it needs a booster. Does that sound familiar? Like the COVID vaccine. So 21 to 28 days later, they need a booster the first time. Then, and the next year, they only need 1. So you just have to make sure you catch your ewe lambs each time and do them a month later. So where I live, I ran into this problem with liver flukes, and they were liver flukes from the deer. So they were flukes that were not in their normal host. They were traveling around through my sheep somehow, and they were dragging Clostridium with them, and the Clostridium would kill the sheep, not the flukes exactly, but the Clostridium. And so they'd be fine one day and dead the next, which is typical of many Clostridiums. So I needed to go to a 7 or 8-way, and the problem is the 7-way doesn't have tetanus, and we really need tetanus. So I actually do 7-way in the fall, which is when I'm likely to have flukes if there are any, and I do the 3-way here in the next, probably the end of March, about a month before I start lambing, to make sure that tetanus protection is in the colostrum for the babies. There is an 8-way called Covexin 8. It's very thick. They don't like it because it hurts. I don't like giving it to them because it hurts, and then they're mad and they don't want to be around me. And then when I go to give them shots the next time, they all remember. So I've been going to twice a year doing the 7 or 8-way in the fall and the 3-way in the spring. For years, as long as I can remember, we've gotten away with just doing the 3-way once a year at Cooperative Extension. And we do that after shearing because that's when you can actually vaccinate wool sheep a little easier. And they've been fine. So it kind of depends what's in your area, what problems you've run into, but that's probably the most standard vaccination for sheep flocks. There are other vaccines, and I'll talk about them a little bit when we get to the different diseases. Most of them are not recommended unless there's a real problem because they have other problems that they cause. I put BOCI there. BOCI is the most common commercial form of selenium and vitamin E. There's now lots of generic ones as well. Many people give this routinely to lambs when they're born or to use while they're pregnant, but it kind of depends on your situation. We've really tried hard to get enough minerals into our sheep so that we don't have to use BOCI injections for the ewes or the newborn lambs. You have to be a little careful because BOCI has selenium, and selenium, you need selenium, but too much selenium is also poisonous, right? So you want to work with a vet to know how much to give if you need to give it. And you're also going to give minerals that have selenium in it, so it's a little tricky. We just basically try to give minerals, and we treat it if we see white muscle disease, which we almost never do. White muscle disease is what happens when lambs are low in selenium, and they'll do what we call a bunny hop, like they trot with their front legs and hop with their back legs, kind of like they're stiff. Sometimes, if it's really bad, they'll have trouble suckling, but I don't think we've ever had any that were of that sort of bad. And they say when they don't clean, when the ewes don't drop their placenta, that could be related to low selenium as well. I find low selenium gets blamed for almost anything that we can't explain. So I'm not sure what's really true. I mean, you can have your the blood level tested on your sheep of selenium, and that would probably be a good thing to do if you're having a more than a consistent problem. And vitamin E and selenium are linked. You need vitamin E for selenium to be effective. So that's why most of the injections have vitamin E and selenium in them together. And could also explain why, if you're feeding year-old hay or your hay in the spring that you made the year before, could be fairly low in vitamin E, and which may make it hard for your animals to absorb the selenium. So most of our mineral mixes do have vitamin E in them as well. So where are we going to vaccinate? Where are we going to poke these poor little sheep? We're going to try to avoid the expensive cuts of meat. So if you've ever cut up meat, you know there can be blemishes in the meat caused by needle pricks and injections. And so we're going to use the neck. I'm going to show you a picture in a minute. The skin in front of the shoulder. And there's a big muscle there from the shoulder up to the head. You don't want to go too low on the neck because that's where the jugular vein is, unless of course, you're trying to draw blood or something. And along the top is a big tendon, and you don't want to hit that either. So I'll show you a picture in just a minute of where to aim for. And we try to use sub-Q, which means subcutaneous, under the skin whenever possible. So I have a way of pushing the sheep's head against my knee with my elbow, and then pulling the skin up with my hand and injecting under the tent. So you make a little tent and put the needle in, release the tent, and squeeze out your syringe. You want to be a little careful not to go through the tent and out the other side. Takes a little practice. I like to use 1/2-inch needles because you can hardly miss then. You're also less likely to poke yourself. So here's Maple. This is my old goat that had to pose for a lot of pictures over the years. And my, let's see, it'd be my left hand. I'm getting my little pointer here. My hand here is right on the front of her shoulder. You don't want to go up here where the tendon is, and you don't want to go down here where the jugular is. So I'm going to go in this spot. There's loose skin there that you can get and pull up. You don't want to jab her in the shoulder blade, so you want to make sure you're going under the skin up in this area. There's also a spot here behind the leg, like if you have a sheep rumped, which means the sheep is on his butt and leaning against your legs, like sitting up against your legs. You can get to that spot easily right behind the front arm or leg. And on sheep, there's not a lot of wool right there, so you can hit them there too. You need somebody to hold them still while you do that. It's a little harder to hold them and hit that spot. If you're really desperate, I have when the sheep are in a big group squished together and you're trying to inject them and they got one crazy one that's like crawling all over the top of everybody and going to hurt somebody, I have just reached over, pulled up the skin on her back and given her the shot under the skin. So you can do it other places. We try to be consistent so we know where to expect any blemishes if there are any. And here's a little trick for when you're working your sheep. I do have handling equipment, which I'll show you in the a PowerPoint that we do on handling. But I do also, a lot of times I just squish the sheep into a small area and I wade through there. And I have that's actually a painting bucket that I got from the hardware store. They gave it to me actually because they were giving them out for promotion. And I hang it off my little cross piece in the roof of my greenhouse. And there's 2 cups in there, one for used syringes and one that I've used and need refilling. And there's a cold pack in there. That's the blue you see. And the vaccine, you don't want that to get warm, so I have the cool pack in there to keep it cold. So then I can fill a bunch of syringes, put them in the clean cup. If I've got a helper, they'll wade through there with me and hand me the cup. And then we'll squirt. We'll either mark them with chalk or paint that they're done, so you don't do one twice. You can't really, I have a lot of beginners that think they're going to vaccinate and then put the sheep out and then vaccinate another one and put them out. Well, you get about halfway through and you reach that critical mass and the rest of them are just going to blast their way out. So I don't recommend that. Keep them all together. Just mark them with chalk or sheep paint, which you can get from your farm supply places. Big sidewalk chalk works amazingly well, even better than the crayons. It only needs to last till you're done, right? We used to always use just spray paint, but sometimes you had so many colors and dots on your sheep, it looked a little bit funny. So little parasite review here. Take the FAMACHA class, the integrated parasite class this summer or read about it online. So you can selectively treat the ewes that need it, because only 20 to 30% of the ewes carry most of the worms, or are shedding most of the eggs, which is really what's important. And then having your sheep in good general health will help them fight off a worm infestation. So good nutrition, good ventilation, all that same stuff we've been talking about. Remember that the young, the stressed, and the really old are more susceptible to parasites. So the young haven't built up resistance. The really old ones, their immune systems are starting to fail. And the ones that are working hard, like nursing triplets on pasture, for example, they really need, they need to be dewormed if they're even look like they might need it, because they're working hard and they can be taken down quickly. So I mentioned evasive grazing when we did the parasite talk. Short durations in each paddock with longer rests than you'd like to have for the forage, but the longer rest helps keep the parasites down when you come back into the pasture. So I stuck this in on hoof care. There is a little video, but I thought I'd show these because this is what I call a deck chair. When I worked at SUNY Canton, which is a 2-year ag and tech school, I ordered a deck chair. And when it came into the inventory place, they were making fun of me. They thought I was going to be sitting around out at the farm in a deck chair. Well, this is a deck chair for sheep, and it's not that easy. You need a person on each side really to flip them in there. But it's great when they're in there, and it's a great teaching tool for me because I can be on one side and I can have students on this side. I also use it for tattooing their ears because they're right there where I can reach them and they can't go away. And when you want to get them out, you just lift up this part and flip them over, and out they go. They occasionally get their feet into the netting, but they seem to come out okay when you flip them over. And then this down here is called a high roller. There's lots of tilt tables that take the sheep and tip them on their side. The problem with those is their feet are still loose and they can like run in place, which makes it really hard to grab their feet and trim. But this one, and this is not a cheap thing, but if you have a lot of sheep, this will work really good. You see that the sheep is in the same upside down position, sitting on its butt, and it tends to make them be calmer. So keep their hooves trimmed. If their feet get long, then they sometimes break off and hurt them. Try not to have them standing in water or manure. Sometimes it's wet in the spring and it's hard to avoid, but make sure there's a dry spot for them to go when they're done. Get a good pair of trimmers. They have a narrow blade. There's pictures of them in the little video, by the way. A long nose. They look like long nose pliers, only they're trimmers, and they should fit in your hand. The old style sheep trimmers are big, and I find them really hard to use. But these narrow bladed, they're like $15. You can get them at Premier or other sheep supply areas. And then you need something to hold the sheep, which I showed you some pictures of there. And I just wanted to warn you not to try to do too many the first day. It can be hard on your back. You can rump the sheep, which I should do a little video on how to rump a sheep, where you stand over the sheep and you bend their head around and you flop them down so they're sitting on the ground. And I can rump big lambs. I can rump some of my ewes, but I can't rump the big ones or the rams because they're too strong. But if you get them sitting down, then they're pretty good once they're there. But it is hard on your back, so you don't want to do too many in one day, and you might want to have the ibuprofen handy. And again, it's going to, like I say, I don't think there's any sheep that I do every year, but I have one that has misshapen feet because of her liver fluke encounter, and so I have to do her a lot. I just pick her feet up like a horse because she's been trimmed so much that she just is fairly easy to do. A lot of it depends on the train, the wetness, the dryness, how active they are. If they're on a bedded pack all winter, like at Extension Farm, they go out in the spring and their feet are a little long, but by the time they come in the fall, they're pretty much back to normal. I just have to sometimes have a hard time finding one that needs trimming for our sheep lab that we do with the vet science students. Try not to buy in problems. So how are you going to do that? Because sometimes you're buying sheep that you haven't seen if you're buying them from another area. But you want to ask a lot of questions. You want to ask for pictures. You want to ask about if they've done any testing or seen any problems. I did manage to buy in yonis which I can totally understand because it is something that's hard to test for. And maybe I think that the person that I bought the sheep from that had Yonis didn't even know what Yonis was, just thought he was losing a sheep to parasites once in a while. And so ask a lot of questions. Look at, if you can go and see the flock, make them walk around, get them up, make them walk around so you can see how their feet are. And you can buy things at the auction, but you really don't know what you're getting unless you happen to know somebody's sent their flock or something, because you just don't know what you're getting. And usually if somebody's sending something to the auction, it's because they don't want to sell it as breeding stock, or it's not going to be good eating. So again, be cautious at the auction. If you can see the flock, pick up some feet and look at them. Ask lots of questions. Now, we all get in that situation where we see a sheep or goat that needs rescuing, and we can't resist bringing it home and trying to save it. So make sure you don't put that one right in with your flock, because you don't know really why it needs rescuing. And so make its own pen and stall, preferably where it can't touch noses with the other sheep. Watch it carefully. Make sure you deworm it with all different kinds of dewormers. Check its feet. And we'll tell you, I have foot scald at my flock, even though I quarantined a group of sheep I got actually as part of a research project. And none of them were limping, but they definitely brought it and gave it to all my other sheep. They apparently had it and were sort of immune to it, or it didn't bother them. They were tough. So be careful buying sheep. I don't know, other than to really look and talk to the person. And actually, when I expanded my flock, I also got some certain kinds of abortions, all kinds of things. I had no sheep health problems ever, really, and then I had them all within a year, and now they've all calmed down again and sort of eliminated them, the problem animals. But wow, you can get into problems. So let's talk about some sheep diseases. There's respiratory diseases. Again, I mentioned ventilation. If you can have good ventilation, you're not likely to have many respiratory problems. But if you see them panting with a fever, not eating, runny nose, coughing, any of those things, the sooner you catch it and treat it, the better. But you're going to want to ask the vet what to use, because there are different things for different times of the year and different types of respiratory problems. Could be viral, in which case your antibiotics aren't going to help. Could be bacterial, and then you might be worth giving them antibiotics. And lungworm will also make them cough. And that, in my part of the world, lungworm coughing starts in the fall and gets about the worst at Christmas. I even had a llama with it once. And luckily, most of your dewormers will kill that, but sometimes there's damage there. And at least around here, lungworm is unusual, but I know I've had it on my farm before. And for a couple of years, I dewormed in the fall when I wouldn't normally bother, like after the frost, after the ground is frozen, just to catch anybody that might have lungworm. I haven't had to do that in the last few years, but I watch carefully for it. You can have gastrointestinal upset problems. We mentioned diarrhea earlier and bloat. I did have once an animal with a blockage. She actually had a twisted gut. She spent 3 or 4 days with her back humped up and then laid down and died, and I did an necropsy. Found you could see where her intestine was twisted. And I had a ewe lamb from her that I really liked, and I called Cornell and asked Dr. Smith, our ruminant specialist, if that was hereditary, because I didn't want to keep the baby. And she didn't think so. She said it's pretty rare, but it does happen. So if you have an animal with a really sore, acting like their stomach is sore, it could be hardware disease, like they could have eaten a nail or something and it's poking them. Not as common in sheep as it is in cows, but they could also have a twisted intestine. It's possible. And then, of course, parasites and coccidiosis, which is a parasite, a single-cell parasite, do cause diarrhea and problems with absorbing nutrients. There we go. So we're going to talk about some actual sheep diseases. So listeriosis is an interesting one, and it is a bacteria, and it's everywhere. It's in the environment, it's in the soil, it can be in silage. It can get in your silage from the soil. sometimes they have listeriosis and you really have no idea where they got it. Keep your feed bunks clean, that helps. But we had like an outbreak of listeria. We were feeding baleage. Some years we had never had any listeria, and then some years we'd have a bad spell, and they were used that were just about to lamb, and it was really, really sad because they became like paralyzed, and I did not have a lot of luck saving them. So they were circling, they would lay down, not get up. And then when they started to not feel good, then they would have ketosis, which we'll talk about in a few minutes also. So it was like a bad spiral. I had one that scratched her ear over and over and over. I actually saved her. They might be drooling. Now, when I say neurological signs, you notice down there it says rabies. We do have rabies in our area here in northern New York, occasionally. And so, meanwhile, I'm sticking my hands in their mouths and picking them up and looking at this and that. And then the vet's saying to me, "You did wear gloves, didn't you?" So fortunately, we sent their heads away to be checked for rabies. Fortunately for me, they did not have rabies. But remember that anytime you see neurological signs, it could be rabies, so protect yourself. They do usually spike a high fever with listeriosis, and you can save them if you catch it early enough and there aren't other complicating factors. Sometimes they walk kind of crooked for the rest of their life, but you can sometimes save them. It's if you see a ewe with a high fever, like pressing her head against the wall or walking in a circle trying to get to the water, it's probably listeriosis, and it definitely warrants a vet call. Now, polio, which is a thiamine deficiency, does cause neurological signs also, and you see it more in lambs. You don't see it as much in adult sheep, but they'll have their heads thrown back. They call it stargazing, up over their, like straight back over their back, and sometimes they're laying down and their feet are paddling like they're walking. And a lot of times they're blind and their brain is swelling, so their head hurts. I can't remember who it was. Somebody posted a picture of one in one of the forums. So if you get a chance to look at that, do that, because there was a good picture of a lamb with fairly typical polio. I might steal that and put it in my talk here, as a matter of fact. It does respond to thiamine. When you go to the store to buy thiamine, you can't really buy straight thiamine. You have to buy high potency B vitamins, which means you need to give more of it. But the vet can give you thiamine that is more concentrated, at least in the U.S. So you need to give them 200 to 500 milligrams of thiamine, and this you give IM. So you're going to go with your half-inch needle or inch needle straight into the neck and inject it there into the muscle. And I didn't realize this, but it's actually absorbed faster out of the muscle than it is sub-Q. And then I usually give them some sort of anti-inflammatory that the vet gave me. It might be dexamethasone or flunixin, like Banamine, which most people call Banamine. Some sort of anti-inflammatory, because their nerves are actually inflamed and their brain is swelling, and you can help them a lot with an anti-inflammatory. Then sometimes they recover real quickly if you catch it early. You may have to give them thiamine several times. Sometimes they have a really hard time, and you have to like drench them with Gatorade and hand feed them and make sure they drink, and then they can come around. So how do they get polio? Usually it's something that disrupts the rumen where they make all the B vitamins, throws off the thiaminases. Too much sulfur. There's a couple different minerals that can interact to cause this. Sometimes, like when we had it once with some animals, we were really feeding heavily, and the water at the farm the well went up for like 8 hours. They had no fresh water, and we didn't seem like it was that long. We put them back on, and we had 2 or 3 in the group of 20 suddenly head pressing, and they were showing signs of polio. They snapped out of it very quickly. The ones I find on pasture, unfortunately, you don't find them as quick on pasture usually. I've found them, and they're already blind, and they're like standing with their heads through the electronet, trying to find the rest of the sheep because they don't know what's happening. So that's, sometimes you have 2 or 3 cases in a summer, sometimes you'll have none. So watch for that. And again, it's hard to say exactly what causes it in each case, but generally it's lack of B vitamins. CLA stands for cassius lymphadenitis, and there's two types of CLA. One is basically external and is in the lymph glands, but there's the ones around the face and the jaw, usually, occasionally on the body, and it makes a little pus pocket. It's really kind of disgusting, sort of greenish, thick pus that comes out of these little spots, and they'll eventually, they'll get bigger and bigger, and they'll pop, and you can push the pus out of them. And I've actually lanced quite a few of them, pushed it out, cleaned them out, and squirted iodine in there. There's another kind of cassius lymphadenitis, though, that is in the viscera and is in their organs on the inside. And unfortunately, I have a friend that has it and gets in the sheep's lungs, and they actually cough like red foam out of their lungs from these lumps causing problems in their lungs, and it'll kill them. In my case, I have a few CL lumps on some of my sheep once in a while. Doesn't appear to affect them at all, and I don't normally see it in their carcasses. So it kind of depends what kind you have. You can try not to buy it in if you see it, but they don't always all show it, so it's hard. Sometimes it's spread by shearing, like if you make little nicks, and then they shearer nicks the next sheep a little bit, it'll spread that way. And by the pus, which of course if it's around their neck and head, and then they put their head through the feeder to eat, the next sheep puts her head in through the feeder. It's pretty hard to avoid. Sore mouth is pretty much what it says. They get little blisters, looks like little chicken pox kinda all around their mouth. I've seen it up on the tops of their head, on their ears. And if you've never had it in your flock and you bring it in, and they spread, the first time you have it, it can be pretty bad. Like the lamb's lips will look like cauliflower, and it'll get on the ewes' udders, and then they don't want the lambs to nurse because it hurts, and then that causes other problems, of course. And there are different strains of it. The next time you get it, like it'll come back a little bit every year. We'll see a few lambs with it, but it doesn't really bother them, and the ewes have all been exposed. We did once bring a ram in. He did not appear to have sore mouth, but we had a big outbreak of sore mouth, so we know that was a different strain from the one we had. Again, it's not really a big economic problem. We have to be careful at the cooperative extension farm because we have a lot of little kids, and it is zoonotic. In other words, you could catch it, and they like to do things like kiss the lambs on the lips, and we have to sort of watch them, not let them pet the lambs or kiss them when they have sore mouth, and make sure they all wash their hands. And you should be careful too. Again, something you can look for when you look at a flock, but it's sort of a seasonal thing. You won't necessarily see it. So it's challenging. I don't know that you can test for it for that matter. Abortions. I'm going to talk more about abortions in a few minutes. If you have one or two, it might be nothing out of a big flock. There are spontaneous abortions, especially early on. You might never know. You might just have a ewe that comes up, doesn't lamb. But if you're losing lambs close to lambing time, like 2 weeks before, 3 weeks before, there's a good chance you have picked up toxo, chlamydia, cache valley fever, that sort of thing. And a lot of those can be stopped. The outbreak can be stopped with oxytetracycline. Have the vet give you the dose, and you do everybody. And sometimes you can stop it. It's really hard to determine which of the things it is. Even if you save the aborted fetuses and the placenta and you put it in your fridge, it can be shipped down to Cornell or wherever your diagnostic lab is, and they can sometimes tell. There's actually a whole PowerPoint in your resources done by a veterinarian, and she talks, well, it might be me talking, but it's her PowerPoint about all the things that you can happen before lambing. Here they are. We're not going to read them all, but that's some of the ones that are out there. They all tend to be late term, and almost all of them are treatable with antibiotics if you can catch them at the right time. And listeria is down there. I have not had abortions related to listeriosis that I know of, but apparently that is something you can get with listeria. So some general advice: if you have abortions, wear gloves and sleeves, especially if you're a woman and you might potentially be pregnant. All of these diseases are bad to catch. Q fever is really bad. I've honestly never seen Q fever that I know of. I'm going to have a whole slide on it though, because the vet that did the PowerPoints, helped me with the PowerPoint, said Q fever can be a real problem. So if you have a barn fridge or freezer, use your barn fridge and store the aborted materials, even if you just have one the first time, because you don't know what else is coming. So you might try to store one. Make sure you put it inside plastic bags and that sort of thing. If you have to dispose of those, ideally you would burn them, although I'm not quite sure how you do that, or you want to put them somewhere where they're not going to get dragged around. You definitely want to get them out of your barn where other animals will be exposed. And have your vet help you work it up. They're going to send it somewhere, most likely, take samples from it and then send it in. They don't normally send the whole thing. And it does require the placenta, the fetus, and blood samples. So keep them in the fridge or the freezer, whichever they advise you, while you're waiting to see what else happens. A few quick notes on Q fever. Again, I've never run into Q fever, thankfully. But it is zoonotic. You can get it from the animals. It is common in sheep and goats. They can be asymptomatic. I guess cattle can get it too. And it does cause a disease. It's very flu-like, very COVID-like actually, pneumonia. But it can cause problems if you're pregnant. And it also can cause long-term problems with your heart. So you want to avoid catching Q fever. It can have long-term complications, I guess is what I'm trying to say. And it's always a good idea if you're not feeling well and you're not sure what's wrong, to mention to your doctor that you do work with sheep and goats. When I had sore mouth, I had it on my finger and my neck. I must have scratched my neck from the black flies or something. And the physician was pretty perplexed. But after I told him I worked with sheep and goats, apparently he went and looked through his Merck's manual for people. And he said, could you have, they called it orth. And I said, yep, matter of fact, the sheep have that. I just didn't make the connection. So I mentioned foot scald and foot rot before. So if you take a sheep's foot and you're looking at you got them tipped up and you're looking at the bottom of their foot and you pull their little claws apart and it's wet and pink in there, maybe whitish, like sort of soggy and tender, like it hurts them when you pull the two claws apart, that's foot scald. If it's gone up in the separation of the outer edge of the hoof from the middle, that's foot rot. And it's hard to beat once you have it, because there's carriers that don't limp. And I've tried everything, and I have it at a dull roar now. I just have one or two sheep that limp on one foot, but it can be a lot of work to get rid of. I've tried foot baths, and I have a solution there, the zinc sulfate solution. To make a 10% solution, you need 16 pounds of zinc sulfate, which you can usually get the feed store to order for you, and 20 gallons of water, and you can make bigger or smaller batches as long as you use that ratio. And I had a foot bath that I crammed like 12 sheep and goats in, and I tied them in there really. I put panels around it, and the goats are really good at like straddling the foot bath, but we squished them in hard enough so they couldn't do that. We all went and ate lunch and came back like half an hour. And those animals did pretty well after that. That really seemed to help, but it's a lot of work and the weather's got to be right and got to be a little careful disposing of the zinc sulfate water and that sort of thing. But there's also some advice on the Cornell website about using formaldehyde diluted to a certain strength and spraying their feet. Now, it is a carcinogen, so you want to be really careful if you're using that. You're wearing gloves, don't breathe, don't spray it near your face. You don't want to breathe it in or get it on your skin. I sometimes do that. I don't know if it helps any more than zinc sulfate or anything else. Ideally, eventually you cull out the animal that is carrying it, and that'll help. Supposedly, if you keep them, you get them all cleaned up and they spend 2 weeks off of your ground, like closed in the barn, and you let them back out, they'll be okay. But I haven't found that to be true either, unfortunately. So foot problems can be very challenging. as can Yonis. It looks like John's disease, but it's actually pronounced Yonis. There's a great website from the Wisconsin Diagnostic Lab, or somewhere at the University of Wisconsin. That's I think it's yonis.org. It's a wasting disease that attacks the small intestine, and they'll eat like crazy, but they'll get thinner and thinner. And you can see that's a sheep, unfortunately, from my flock down there. And eventually they'll just die of starvation. So there is a test. It takes 60 days to find out. They culture it, and it's not that accurate. So usually after 60 days, if a sheep looks sick enough to test, they're either dead or almost dead. You can't treat it. So now I really watch for the signs, and I cull animals that look like they might have it. They don't test positive until they're shedding the organism, which doesn't happen until they're 2, 3, 4 years old. Most of mine were about 4 when they came down with it or started to show signs. And sometimes people think they've got a parasite problem because they will sometimes have diarrhea, and sometimes they don't, but it sure looks like parasites because they lose weight and they look unthrifty, and their immune system is depressed, so the worms are taking advantage of them. It's a really frustrating disease, I can tell you that. And I do think there's a genetic component as well. I don't know how you would test for it. In other animals, they do have more of a quicker test, and they are working at Cornell right now on a test that shows whether your animals have been exposed to it or not, which would help you maybe make some culling decisions. So it's cows get this as well as almost all other animals. It's a very interesting website if you get a chance to look at it. Very frustrating disease. We've actually done a whole study on the prevalence of Yonis in the North Country, and almost everybody. We did 3 different tests on all the different sheep that we tested, and almost every flock had some animal that tested positive on one of the tests, and we had nobody that tested positive on the fecal long-term culture test. So that lets us know that the tests maybe aren't as accurate, and it's out there, but it's at a real low level. It's a very interesting thing to study. Very frustrating to deal with in your flock. We do not have it at the Cooperative Extension Farm, and I try to be very careful not to take it there. So some other sheep diseases, mastitis, which is an infection in the udder. There's a whole PowerPoint on mastitis in your resources because that's a topic that I'm not real familiar with. I don't have a lot of mastitis in sheep. When you do, it's not that easy to treat, but you can treat it. You need to be, there's a type of mastitis, gangrenous mastitis, where their udder actually, whatever half the mastitis is in, will turn blue and basically fall off eventually and heal over in an amazing way if you can keep them alive. And of course, that side of their udder isn't any good anymore. And there's more like your chronic mastitis where they've got flakes and things in the mastitis and they don't feel good, or they might be septic. So definitely talk to a vet if you have mastitis. And what that looks like is either watery milk with flakes in it, or an udder that's pink and hot. Like you can tell there's an infection in there. Might be hard to the touch, might be hard to get the milk out. That can be mastitis. And generally that's because something got up inside the udder through the teat canal. So lambing in a clean place helps. Lambing outside on the clean grass, that kind of thing. Milk fever. So those of you with cows are probably familiar with milk fever. Milk fever happens when there's a big draw on the calcium in the body, and it sort of is a neurological, kind of makes them really depressed. It does happen in sheep sometimes, not real often if you've been keeping your minerals up and feeding them well, but they have this typical look where they lay down and they have their neck sort of stretched out in front of them and their front feet sort of out in front of them, flat on their chest, kind of. And a lot of times they're drooling because they're having trouble swallowing. If you get calcium gluconate, which almost every feed store has, so it's a liquid, comes in like a 20-ounce bottle, and you can load up syringes and you can give it to them under the skin, like 75 mLs under the skin, not all in one place, like 10 or 12 in each place under the skin of the back and the neck, wherever you can get it. That will usually snap them out of it, and they'll suddenly like blink their eyes and stand up and go back to nursing their babies. And then and it's sort of miraculous to watch, but it's worth keeping calcium gluconate on hand. I think in all the lambings I've seen, I think I've only had milk fever twice, so it's not a common problem. I'm going to mention grass tetany. Where I live, grass tetany isn't a big problem. We don't have a lot of legumes in the early spring pasture, but it can be if their minerals are off and they get into lush pasture when they haven't had it. It throws them off on the inside, and they'll be like shaky. That's the only way I can think to describe it, and excitable, and then it can actually kill them. So it happens especially if they've been held off feed. So when you're introducing your sheep to pasture in the spring, if you have seasonal pasture, you want to make sure they got a belly full of hay when they go out there the first time or two, and so they don't just load up on the lush pasture. And so we just sort of put them out in the afternoon and bring them in and slowly get them onto the pasture, and try to keep our minerals, feeding good sheep minerals.
Betsy, there's a comment here.
Sure.
Nora shared, we have old cows with mastitis and milk fever. Are old sheep susceptible to it?
I'm not sure. I've only had 2 cases. They were both experienced sheep, like it wasn't their first time, and they were both really good producers. But I don't really know the answer to that for sure.
I don't have any experience either.
Fortunately, it's not too common. I want to mention urinary calculi or kidney stones. This can be a real problem in wethers and rams, more than female sheep and goats. And the problem is you really need a 2-to-1 calcium phosphorus ratio in their diet or something close to that. And if you feed, this is why I say never feed your rams corn, straight corn, because corn's really high in phosphorus, and that will lead to urinary calculi. So make sure they have a good mineral. Make sure you're not feeding straight corn. You can feed a commercial mix that has the minerals. It might have corn in it, but it has other things in it as well. A lot of sheep grains have ammonium chloride. You can ask about that. It's put into the feed, and that helps prevent urinary calculi. It's a really hard thing to treat once they have it, and what you'll see is an animal straining. I could probably find a picture of this too, now that I think about it. They look like they're trying to pee, but they got their back arched up because it's not working and it hurts. Sometimes they can pass the crystals, but if you could feed, you can actually drench them with ammonium chloride. I actually went around and collected off the internet all the things I could find about urinary calculi and put them all in one Word document. So if anybody really wants that, I can email it out or put it in the resources, but it's just sort of a hodgepodge, but it does have some good tips on treating it if it comes along. They can also, if it's really a pet or something, they'll actually cut the ureter through the skin on the back side of the animal and try to get the stones out, but then you've got a mess for the rest of that animal's life. So avoid it. Avoid it is much easier. Sheep do get pink eye. It's not the same pink eye that cows get, usually at least, and it usually will resolve itself. You can treat it if it's bad, and there's a couple different ones. I was reading about it earlier, and it's it's too complicated really for me to explain. But I've had it pass through in the winter when there's no flies. Just sort of odd because you think of pink eye as coming from flies, and there's no pink eye vaccine for sheep. So it's not normally a big problem. Sometimes you'll see lambs with eyes that look terribly irritated and you think they have pink eye, but what they really have is called entropion eyelid. And what happens is they're born and their lower eyelid rolls in towards their eye, and the little lower eyelashes are irritating the eye. And if you catch that lamb and pull down on the eyelid and get those eyelashes out and keep doing it, the eye will heal up. And eventually they usually outgrow that. There's other things you can do. You can inject a little fluid near the lower eyelid to puff it out. It's a genetic thing, so if you're having it, it could be the ram carrying it. You can also use a little clip, and you clip it sideways under the eye to hold the eyelid out. Just sort of puffs it up to make the eyelid fatter. They usually outgrow it when they get a little meat on their bones and the eyelid gets a little fatter, so to speak. That's called entropion. Now, we're going to talk about pregnancy toxemia in a minute. That's basically ketosis, and it's not an easy thing to treat. And you try another good thing to avoid. And we're also going to look at prolapsed vagina. So let's talk about pregnancy toxemia. If you're feeding your sheep right and they're in the right body condition, you're not likely to have pregnancy toxemia. We rarely have it here at Extension. I've never had it at home. It can happen in ewes that are carrying multiple fetuses because it has to do with the draw on the mother. So if she can't meet her needs by her nutritional intake, it's going to draw off her body. And what did I tell you about feeding animals that are fat? They don't have much room in there, right? Because there's fat taking up space. So what happens is the animals you would think would have plenty to draw on, fat animals, are the ones that tend to have pregnancy toxemia. Or really thin animals with inadequate nutrition. But I'd honestly rather have a little thinner animal than a fat one in terms of ketosis, because they can usually at least eat more. Or sometimes they go off feed because of the listeria, or they got a limp and they aren't getting up to the feed bunk or something like that, and that can really throw them into ketosis also. So what actually happens, and this is kind of interesting, the fetus requires glucose from the dam, and the other energy sources like ketones or free fatty acids that they get from their rumen don't cross the placenta, so the mother has to make glucose. And when they're not met by the diet, when the needs are not met by the diet, the animal's body fat is mobilized, and the fat, the only place it can be converted to glucose is in the liver, and you sometimes get actually a fatty liver. And when the liver's ability to convert fat is exceeded, the liver is full of fat, and then they make ketone bodies. So they become ketotic. And of course, those ketones won't help the doe or the ewe, and so, or they won't pass into the fetus, and so she has can't meet her. Sorry, I have to let my dog out. It's a good thing I have headphones on. Here we go. Sorry. So if there's ketosis, the animal starts to feel bad and will isolate herself from the others and get up and down really slowly. As it gets worse, she won't even be able to get up, and she'll act blind, and she might start shaking. A lot of those neurological signs like stargazing. She might eventually fall into a coma, so or pant. If the fetuses die inside, then sometimes the ewe suddenly feels better. Or if you can get the fetuses out, like if she's close to delivering and you can get the babies, she'll immediately feel better. So you can actually diagnose this by looking for ketones in the milk or the urine or the plasma. And so I keep keto sticks in the barn just in case. I haven't had to use them, thankfully. And the blood glucose is low early, and later on it's high in the body, which is interesting. But I can't really explain it to you. So early on, when they're not down yet, but you can tell they're not feeling good, you can use propylene glycol, which comes in a big jug, usually from your feed store or your vet, 2 to 4 ounces twice a day. You can't give them too much because it's hard on the rumen bacteria. So 4 ounces is half of a kitchen measuring cup, just to give you an idea how much that is. If they're down, it's really hard. You usually need to do IV fluids with dextrose. And even then, it's hard because if they get to that point, it's really hard to stop the metabolic chain that's happening. So try the best way to do is to avoid it. Feed them appropriately during late gestation. Try not to let them get too fat or too thin. Monitor their body condition. Again, hard to do when they have a lot of wool, so you need to put your hands on your animals. And watch them for other diseases that might make them predisposed to ketosis, like unable to walk or listeriosis or other things. Make sure they can get up to the feed bunk. And you can monitor their urine for ketone. If you wait till an animal gets up, they usually pee right after they stand up. If you're quick, you can either catch it or you can stick the keto stick in there. So the riskier ones are older, heavier, and tend to have more babies. So if you have one that has triplets and quads, or if they aren't feeling good for other reasons. So hopefully that didn't scare you, because it's not that common if you do all the other things right. Let's talk about a few things that happen before they have their babies. And one of those is vaginal prolapse. So if you see in the picture there, I need my little pointers here. That looks sort of like a pink grapefruit sticking out of the U is actually the vagina sort of pushed out of her body. And so you're seeing the lining of the vagina. And what can happen is now it's irritated because it's out, and she'll keep trying to push. And the bladder, which sits just below the vagina, will like pop out and sort of flop into that ball, which then you have that in there as well, and it makes it harder to go back in. So keep that in mind when you're catching the U and you're replacing that. You're going to want to push with your whole hands around it, not like in one particular spot, because you don't want to pop anything or break through anything. You push it back in. You have to push pretty hard. Once it's in, they're going to pee like crazy all over you, and then you're going to use a strap or a spoon to hold it in. I got a picture of that in just a minute. Usually happens within 2 weeks of lambing, or a month to 2 weeks of lambing. Can be because the tail is docked too short, but I think it's mostly because they're pushing. A lot of times they're putting their feet up on the feeder. Like in my case, on the round bale feeders, they like to put their feet up there and reach through up above the bale, and that means all their organs and anything they ate, everything's pushing back on the uterus and the lambs and sort of popping that out. They're just big, and they have a lot of lambs in there. And I've found if you feed them, like we fed them once baleage, that they just love so much that they would just stuff themselves with it, and then they'd lay down and pant because it was warm out, and they'd prolapse a little bit. So sometimes they'll prolapse when they're laying down. When they stand up, it just flops back in, which is fine as long as the bladder doesn't get in there, because that'll sort of keep it from going back in. So if you can keep them from standing up on their front legs, up on things, that helps. And you need to use a retainer if it won't stay. The vet will sometimes stitch it, but if you know they're going to lamb, you need to take the stitches out, whereas the strap and the spoon, they can actually lamb around. And one of the problems is they keep wanting to push, so you just get it in and they push it out. So some of these straps work better if you can get them on, the sooner the better. So the red strap that you see is one you can buy, and it comes down their back and it goes over their tail. It does collect some manure here. You can sort of shake it out as you go by the sheep, if you can catch them. These straps go down around their legs and then clip here. And then this goes around their neck. And you want that not so tight it's uncomfortable, but so that they can't hump their back up and push. I find this strap works great. And you wouldn't think they could possibly lamb around the strap, but they do it every time, and they don't seem to have a problem. So it's amazing to me, but it works. This is a spoon, what we call a spoon, and this part goes in the vagina. And then these parts, you either put a strap or you tie it to the wool if they have wool. I don't like that because when this is in there, it does keep the vagina in, but it also irritates, and they want to push because they feel that there. So I prefer the strap, but different people have made different things work. I've even used baling twine when I was desperate until I could get the strap on to make like a makeshift harness that looks just like this. Generally, I would not keep a ewe that prolapsed unless I thought it was my fault for some reason, because we don't really know what causes it.
So Betsy,
it says here.
There's a question here or Nora shared a comment that when she had a chicken with prolapse, she washed it. Should you wash a sheep with prolapse?
If it's dirty, usually it's not that dirty because it's above I suppose if it's really dry, like if you didn't catch it right away, you might need to rinse it off. It's kind of hard. Like if it's 20 degrees out, you don't really want to pour water on it either. But yes, you could wash it off.
Yeah, you don't want to really push any dirt back in there.
Yeah, right. You don't want to put a lot of junk back in there if you don't have to. So we're going to talk quick about dystocia. I did a whole kitting and lambing video. It's like an hour long, another hour long webinar. Sorry about that, but that's in your this week's information as well. It's about all the, watching for labor, having the ewe ready, all the different types of lambing problems. So I'm just going to quick look at a couple of things about dystocia. Dystocia means not lambing correctly. And a normal gestation is about 150 days. A lot of times it's 145. And the first part, their cervix is dilating, and you won't necessarily see anything. You might see the ewe panting a little, or like getting up and laying down, trying to get comfortable. When they actually start to push, their head will kind of raise up and look back when they're pushing. You can actually sort of tell they're pushing. And the last part of labor is when they pass the placenta, and that's after the babies are born. And then for the next few weeks, they sometimes have a little discharge. So the normal way for a lamb to come out is with both feet forwards, with its head resting on its front legs, and like Superman flying through the air. Hopefully they all come out that easy. And most of them do happen unassisted, but you can have some problems. Sometimes they're just in the wrong position. Sometimes you have a big baby and a small mom. Occasionally you have something like milk fever where the ewe is not feeling great, and so she kind of quits in the middle, which that's all these things are solvable. You can have a twisted uterine, very rare. Ringworm, which is a failure to dilate. Again, I've never had that happen. That didn't resolve on its own eventually. Here's a couple of pictures of lambs in some typical positions. We're not going to read all this, just telling you that when you're careful, or when you're trying to assist in a delivery, you want to use lubricant. You want to make your hand small so that your fingers together. You don't want to be poking into the flesh of the ewe. You have to be fairly strong. You want to take your watch off, your rings off, that sort of thing, so you're not scratching anything that you don't want to. And you're going to have to feel in there, and you're going to have to feel for things you recognize, like teeth and hooves and ears and eye sockets, to really figure out the position of the lamb. I have to sort of really close my eyes and concentrate. Most of the time it's pretty obvious that they've got one leg back, or they're just got their elbows are stuck. Like sometimes you will push really hard. She'll actually push the lamb up over its feet so that the feet and the nose are sticking out, but you need to get the legs so they're out further. The hardest one is the head back. If the head is back, usually something's wrong with the lamb, and the lamb is really weak, and so it's really hard to get them in the right position. Or when you sometimes find 3 legs sticking out, and then you need to figure out who those legs belong to, and how many, whether it's one lamb, 3 legs from one lamb, or 3 legs from 3 lambs, or 3 legs from one lamb and a little one from another. Sometimes I think I'm never going to get it, and then all of a sudden it becomes clear. So don't give up. Watch the kitting and lambing video. You'll see pictures of all the different types of dystocia with some advice. Here's some pictures of those now. You can see the correct position over on the right at the top. And then here's 2 coming together. This is fairly common. Coming out backwards isn't bad, like this with the feet first. They pop right out, actually. I have delivered lambs butt first. So if they're big, you got to get a foot or 2 out to get them out. And you can deliver a lamb with one leg. If you can get the other leg, that's better. And you sometimes have to push them back into the ewe, which I haven't given birth myself. I hate doing that to the ewe, but sometimes you need to get them back where there's a little more room in order to get them out. So we talked about fetal-maternal mismatch. Try not to do that. You try not to use a giant ram on a small frame sheep, for example. Never had to do a C-section on a ewe, thankfully. A vet could tell you whether it's possible and whether it's worth it. And I use the little squirt bottles of blue lube. If you're really, J-lube will do it, but very hard to get off of you afterwards, by the way. But it is good if you've got a real problem. again, it's nice to have a vet you can call or another sheep farmer that can help you. Mentioned milk fever. You know, basically you've got a ewe that's weak and might have a hard time. Again, rare. A couple other, I want to keep going here because it's getting late and have you watch the kidding and lambing instead of talking about it now. There are poisonous plants out there for sheep, but they're not normally a problem unless that's the only thing left to eat. Like, they don't normally eat poisonous plants unless they have to. Once in a while you get one that decides they have a liking for something like that, but it's pretty unusual. And like things like milkweed, which our sheep eat milkweed like crazy, doesn't bother them at all. But certain forms of milkweed, like out west, the milkweed can be poisonous. So it depends a little where you are. You might check with your land grant university or your extension. Find out what poisonous plants are in your area. We have wild parsnip, which now is spreading because they've changed the way they trim the roadsides, or the timing of when they trim the roadsides, and they're actually spraying wild parsnip seeds into the hayfields with their mowers. And too much parsnip in the hay will cause problems. If they'll pick around it if they can, usually. So it's something to watch for. They generally won't eat it if it's in the pasture unless that's all there is to eat. The wild parsnip will cause them to be photosensitive and cause like burning on their mouth, around their mouth and their nose. Scrapie is sort of like mad cow disease, only in sheep. It's caused by a prion. Fortunately, we don't have a lot of it in my area. There is some just over the border in Canada. And there is a program. We're all supposed to use scrapie tags when we sell our sheep off the farm. And those are permanent ID that's traceable back to our farm. And so they're sampling for scrapie at the slaughterhouses. And that way they can trace back to the source farm of these animals and try to eradicate scrapie. There's, again, not a lot of it in the U.S., but they would like to not have it at all. So that is one of the things the USDA is tracing. In New York State, you can order your scrapie tags. You can order some from ag and markets. And you can also order them from most of the sheep companies. And I don't know if the form, I haven't put the form up. I'm not sure if the form is in our resources or not, but
it is actually in them.
Okay.
Yeah.
I should check and make sure it's the most, okay, make sure it's the most recent one. So we're trying to get rid of scrapie. It is more common in the black-face breeds and out west than it is in the Northeast. OPP is ovine progressive pneumonia. If you have goats with CAE, that's a similar disease. It can cause their udders to be hard, but not really have mastitis. They have what they call a hard bag. It looks like a beautiful udder. It's hard, but nothing comes out. Sometimes it's breathing problems. Sometimes they have trouble just maintaining their thriftiness. It's one of those great diseases that's hard to test for and hard to eliminate because there's carriers. And your best bet for getting rid of it is culling animals that have it. You have to test. There's a whole system of testing. You'd have to work with a vet. It's a blood test, and they test them at a certain age, and then like every 6 months for a certain amount of time, and they will tell you which ones to cull. And you can make progress on eliminating it if you have it in your flock. Fortunately, we are OPP free both at home and at work from our testing program. There's a great website that explains OPP, oppsociety.org, if you're interested. So what if you've done everything you can, but your sheep or lamb still dies, or you find one dead and you don't know why? You can do a necropsy. Ideally, you'd have the vet do a necropsy, especially if you've had some problem that's happened a couple times and you don't know the cause. Sometimes when you lose a sheep, you think, well, sometimes you lose a sheep. But if you're having, more than just a coincidence, sort of a problem, having the vet do a necropsy, first of all, it's really interesting to watch. And they'll take samples of all different tissues and send them to the diagnostic lab. And you'll get all kinds of information back, hopefully. Sometimes even with a necropsy, you don't know, but it's worth a try. you can eliminate a lot of things that way. If you can't do that, you can at least do sort of a gross necropsy and look at the liver and the lungs and the heart and the intestines yourself. And you can also take pictures of the different parts and send them to your vet. So if you're like me and you enjoy doing this and you cut up more than one, you've cut up several lambs and looked at them, you start to know what you're looking for. And you can say, ooh, this liver doesn't look that good. I'm going to send a picture to my vet and ask her, are these lungs, what is this white sinewy stuff in this lung? You know, that shouldn't be there. I mean, it takes a long time to do a full necropsy, but you can look in there and see some of the basic things pretty easily. We did post a form that's how to do a digital necropsy, what you should take pictures of, and what you should send to your vet. I would talk to your vet about it first. They may appreciate it. And we've also delivered the vet. You know, if the vet doesn't have time to make a call, you can sometimes, especially if the weather's cold, you can take it and leave it on their doorstep or wherever they ask you to leave it, and they'll do it when they have time and get back to you. And sometimes they appreciate that. Here's some necropsy pictures of things that I've experienced. Just to scare you a little bit, this is the liver here up here on the left. That's my kitchen sink. Unfortunately, this is a liver that's been ravaged by liver flukes and Clostridium. It should look smooth and brown and should not have any of those black and white marks. This is the gallbladder. That is supposed to be greenish. That's okay. And I was smart and had gloves on for that one. Over here, excuse me, this is a liver I cut in half. It doesn't look great either. And these yellow spots are probably caseous lymphadenitis abscesses in the liver. And yes, I should have gloves on. This was a lamb that died, and you can see if you look at the intestine, it has black areas and yellow areas, and it should be all sort of pinker. So it had some sort of intestinal, could be Clostridium or like overeating disease, something along those lines. And this is the inside of a rumen of a lamb that was probably maybe 4 or 5 months old and just was off for a while and finally died. And we don't really know what caused all these lesions and soreness in the rumen, but it had these gray patches. Even the vet was pretty stymied, wasn't sure what that was caused by, whether it was, we know that this lamb ate a whole lot of minerals one day when we first put minerals in. We don't know if that caused the irritation and then it got worse and worse, or if it just had some other sickness, but that was probably what caused its death right there. So you can do a necropsy. There are things you can see. About 50% of the time you look through the whole thing and you don't find any reason. But again, wear gloves. You need a really good knife. There's a whole series of where you start and that sort of thing. So hopefully that's on your digital necropsy page. So what if they die? What are you going to do with this animal? Especially like right now here, you can't really dig a hole. If it's the time of year where you can dig a hole and bury them. You want to make sure you bury them far enough down so your guard dogs don't unbury them for you, or bury them outside of your pasture, ideally. Some people put them out back in the woods, and you're just feeding the coyotes.
That's not legal.
Oh, is it not legal, actually?
It is not legal.
Oh, that's good to know.
In burial in New York State, it has to be covered with at least 3 foot of dirt.
Whew.
So that's pretty deep for carcass burial.
That's like backhoe material.
That's backhoe material. So composting is
your
best
I pretty
bet.
much have to compost.
And we can put a good resource in.
Yeah, that's a good idea because it isn't hard to do. The picture is, I had a ewe die out in the pasture and I didn't have a way to really get her back up. I actually composted her in place. I brought down several wheelbarrow loads of hay and then manure from my manure pile that has wood bedding and fresh manure. And I put it in layers and covered her up. And then I put something around it because the dogs do like to dig around in it. And a year later.
I'll add that.
Go ahead.
I'm sorry, I'll add that resource on composting.
Okay, great.
To the Moodle site. But yes, it is illegal, I believe, in every state, not just in New York, to put it out back and feed it to wildlife.
So try composting. I have a little compost pile outside of my barn that I use for animals that die. I especially didn't want to put Yoni's animals in my normal compost pile and spread that back on the land. So I have a special spot where I put those. But you can see here, after a year, there was grass growing there. You couldn't really tell there was ever a dead sheep there. I just pulled the posts and moved on. It is, and it's not hard to do. So some references. I know I'm running you over here. It's a lot of talking. I use my infovets.com notebook. It's a big loose leaf notebook. It has, it's a wealth of information. It has each disease, the cause, the treatment, preventive, everything you could think of. I look up stuff in there constantly. And I did go to the website to be sure they still had that available. They have it on a CD and they have it in a notebook. And you can buy like a monthly subscription for online. The problem is it does say that the website is not that secure. So maybe you want to call an order instead of order online or something. Just watch out for that. But they are available and it is a great resource. And it costs, I think, less than $100. Dr. Smith's book, especially if you have goats, is really good. There are fact sheets at the Cornell website. They're a little tricky to find. I should have just put the website on here. That big acronym you see, NISGAP, stands for New York State Sheep and Goat Health Assurance Program. And that's a program where the state vet comes to your farm and your local vet come to your farm and they go through your management practices, any disease problems you're having, and they write up a little plan. And then they do it once a year, and the state actually pays your vet to come and do that. And I would, if you have a chance to take advantage of that, if you're in New York State, why not do that? I mean, it's a great chance to have the vet there to just talk things over. But at their website online, there are some fact sheets about different diseases. The Maryland sheepgoat.com, sheepandgoat.com, other university sites often have really good information about parasites, diseases, and that sort of thing. There's the OPP site I mentioned, the yonis.org. And those PowerPoints I put in there that are by Dr. Jen Nightingale, who's from Jefferson County, New York, and is a veterinarian, and did a great program for us on the things that happen to your sheep at parturition and also mastitis. So that's what I have for tonight. I know it's a lot of talking and not a lot of pictures, and I don't want to scare you because sheep are generally healthy. It pays to keep an eye on them and catch things early. Are there other questions?
I did miss a question earlier on. Christopher had asked, how do you detect coccidiosis?
Usually doing a fecal sample, what you usually see is it tends to hit animals from like 3 weeks to 3 months old, young animals, and it's a dark colored loose feces and very dark, like sometimes black, and they can sort of have it chronically. And usually your large animals, your adult animals all carry a little coccidiosis but aren't affected by it, but they're shedding it into the environment. So sometimes we'll feed in the month before lambing, we'll actually feed a mineral with decox in it, and decox helps suppress the coccidiosis, and then there's less in the environment when the lambs are born. But if you see it in your lambs, you have lambs that are looking a little dumpy and have this black, dark colored runny manure or loose manure, you could do a fecal sample and see if they have coccidiosis. And there are a couple different things. You can treat it in the drinking water. I use a drench. I do it as a drench 5 days in a row, which is hard if you have a lot of lambs, but is really effective because you can really control what they're getting. And it tends to be more of an in the barn problem than a pasture problem.
All right. Again, I will post those resources on composting because that is something we can do year round. Any other questions? I just scanning through here. I think we got the rest.
Good. Thanks, everybody. Sorry to run you over. It's a long time to sit still. Next week, we'll get to see Richard talk instead of listen to me for the whole time. And I'm looking forward to that myself. So have a great week, and we'll see you next week.
Thanks, everyone. Good night, Bets.
Good night.